Plasmapheresis. Plasmapheresis. A process in which the plasma is separated from the blood. Process. Centrifugation. Spins the blood, which divides it according to the density of the parts. Filtration. Passes the blood through a filter to separate plasma. Purposes. Plasma exchange. Remove causative antibodies which attack the immune system. A machine. Can be used to remove the affected plasma and replace it with good plasma or a plasma substitute. It can be saline or albumin, or the plasma is treated and then returned to the body. Plasma donation. The plasma is removed and the blood cells are returned to the body. Medical conditions to treat brain and nervous system conditions. Acute Guillain-Barré syndrome. Myasthenia gravis, chronic inflammatory demyelinating polyneuropathy, Lambert-Eaton myasthenic syndrome, blood disorders. Thrombotic thrombocytopenic purpura, certain complications of sickle cell disease, some kidney conditions. Goodpasture syndrome, hyperviscosity syndromes, myeloma. Contraindication. Hypocalcemia, allergies to heparin, allergies to frozen albumin or plasma. Hemodynamically unstable, unstable blood pressure, people who are not able to tolerate central line placement. Risks for donor. Breathless, cold hands and feet due to imbalance of fluids occurs for a short time. A medical professional may pause the process to allow for recovery. Become ill more easily due to temporary weakened immunity. To avoid, wash the hands frequently and avoid being around anyone who is unwell. Dizziness, blurry vision, feeling cold, faintness, stomach cramps. Shock due to temporary low blood pressure. Risks for recipient. Allergic reaction. Medications before the procedure is recommended. Blood clotting. Anticoagulant may be prescribed. Infection. During the donation process, plasma is screened for bacteria or disease. Cf. Dialysis.